Talking about your relationship with your doctor. It can be frustrating and trying when you're most vulnerable. Now, what you need is an insider, someone who will let you in on the secrets of a doctor's office. And you know what? We found her. She can help rescue all of us from the dangers of a difficult doctor.
My name is Betty Long. I'm a registered nurse, and I am president and founder of Guardian Nurses Healthcare Advocates. Today I'm going to accompany a mom and her 10-year-old son to a pediatric gastroenterologist. I've always said you wouldn't enter the legal system without an attorney, and my suggestion is that you don't enter the healthcare system without a nurse advocate. I want to make the patient feel more empowered, because when push comes to shove, it really is about them. Hey, Dr. Kelly, I'm Betty Long, nurse advocate. When I sit there with a patient, they're much calmer and more confident. Dr. Kelly, I have a synopsis. I'm here to translate for folks.
The term we use, biliary dyskinesia.
What's that? I'm here to ask the questions that the patients don't even know what to ask. Is there anything that Lisa can do in terms of feeding him to minimize his symptoms? Or I'm here to fight for them, both on a physical and emotional level, to make sure they get the best care. Patients are so grateful to have somebody to be on their side. What's your understanding of what the game plan is right now?
We're going to get the HIDA scan first, right?
Mm-hmm. My personal mission is to make that patient's journey a little easier, a little less traumatic, so that they feel like they've been supported.
Thank you so much.
See you later.
So much.
Please welcome registered nurse, patient advocate, and president of Guardian Nurses, Betty Long. Welcome to the show.
Thank you.
So you've been on both sides of the patient-doctor equation. You've been in the middle, stuck. What is going on? Where's the tension? Why are we failing?
You know, I think we have one of the best healthcare systems in the world, certainly. But I think we're really focused on the wrong priorities. I mean, we have the best and the brightest doctors, nurses, facilities, but I think we're worried about really profit versus care, sickness versus wellness, and bureaucracy versus patient. And when patients enter the healthcare system, it's a monstrosity that they really don't know how to manage, and no one really coaches them about that, and that's when they're feeling good. So when folks are sick, it's really a recipe for a not a good interaction. And I think we as healthcare professionals don't do a good job of meeting patients where they are and interacting with them in a compassionate, empathetic way. Because I think if we really focused on the patient, the system would be a lot easier.
It is the purpose.
In a perfect world.
In a perfect world. But, you know, we can make it better or closer to perfect. And the purpose of this show is to do just that. Now, few of us lucky enough to have folks like Betty at our side. So she has 3 questions that you have got to ask your doctor. Please write these down if you're at home. The first question is you must ask at your next doctor's office visit without fail is, what do you think this could be? Why is that the #1 question? It seems so sort of obvious.
Well, it may be obvious to you, but you're a doctor. And it's obvious to me as a nurse, but to folks in the audience and at home, you really need to get the conversation started. In my experience, patients are very, very happy to know that a doctor's listening to them, to know that there's going to be a plan put in place. So it's really that initial conversation to say, okay, you are listening to me.
All right, second question you got to ask at your doctor's visit is, what do I hope to learn from this test?
Right, and that is really the critical piece, as you've discussed before, is that what I call the game plan, and I know the other guests have mentioned that, the game plan. So why is this test being ordered? What are you hoping to learn from it? Is it a new med? Is it a specialist visit? Is it a test? Secondly, what's the timeline? What kind of timeline are we talking about? Days, weeks, or months? So you can frame your expectations for how long it's going to take to either diagnose something or, better yet, resolve it. Never assume that no news is good news, okay? I see everybody. Never assume that. Take an active role in finding out. You deserve to know every result of every test, whether it's normal or not. And the other thing is about the health insurance coverage, because when you're ordering a test for me, and we don't like to talk about health insurance coverage much, but you need to know, or the doctor needs to know, if that test, if I have a high deductible plan, it's $1,500, and I say, geez, Dr. Oz, I'm not really sure I want to get that test. Then it's a conversation with you to say, okay, Betty, let's think about what other tests we can come up with. So the conversation has to happen.
These are all the points that we want you, if ideally we're in the right place as healers, to understand. Okay, so the third question you must ask you at your next doctor's office visit is a critical one, is what are my options? Why is that so important?
It's important because you need to understand as patients that you have the right to accept, decline, or engage the doctor in a discussion about what's the game plan going to be. And most importantly, and I know you've said this before, you must understand you can get a second opinion from another doctor, okay? In our work at Guardian Nurses, we do a lot of this. We always recommend to patients that they get a second opinion.
It's the brave thing to do because it makes the system better for all of us. Registered nurse, patient advocate, Betty, thank you very much for joining us.
Thanks.
We'll be right back.